Hi everyone, Dr. Jeff back with Fiona again this week. Ooh, it's pretty cold out. I can't even chilly in the office here, but it is supposed to warm up. So what are we going to talk about this week?
We're gonna do some. We're gonna talk about the different tools we have around the office. So when I came here, I saw all these cool tools or different tools that I haven't really seen before, and I was wondering what they did. So we're doing a video on them.
All right, so one of the first things we have here is this. What is this?
It's a tuning fork.
Yeah, it's actually middle C, which apparently is the best one to use. What do you think we use this for?
For testing hearing.
Yeah, that's one of the major things. Call it Rene's and Weber's test. So it can we make it vibrate, we can kind of test for bone conduction, and we can test for air conduction. So it's kind of a rudimentary test for the differentiating between somebody can't hear, whether it's a bone problem or whether it's a neural problem. So that's one of the good things to do with this. Another thing we might do with it would be
testing for fractures.
Yeah, so we can test our fractures. So if you put this on our fracture site, it's actually going to cause both ends to vibrate, and that's going to cause a sharp pain at the fracture site. It's actually more accurate than getting an x-ray. So we can use it for that. And one last thing we might use it for?
Sensation.
Sensation, exactly. So it vibrates. So one of the cells we have in our skin is for vibration. So for diabetics or people that have neuropathies, we can put this on and we can see if they can feel the vibration or not, put it on their feet. And if they can't feel that vibration, we know there's something going on with their nervous system for testing. So that's a kind of a neat little tool to have in our toolbox. Next thing we're going to have here is a
stethoscope.
Yes, everybody kind of plays doctor with a stethoscope when they're younger. So this will go in your ears. What do we do with this?
Listening to the heart.
Yeah, so listen to your heart, different heart sounds. So looking for murmurs, looking for arrhythmias. So yeah, listening to what your heart is doing. What else can we do with this?
Also the chest.
Yeah, the chest. So we can listen to different heart sounds. So people with bronchitis are going to get a bit of a wheeze because the bronchial tubes actually get skinnier and the air travels faster, so you get a bit of a wheeze going on. So we can listen for that, seeing if you have bronchitis or not. Also, if you have pneumonia, what can happen is air can't get in there. So we listen to it, there's not going to be any sound, but you might hear some bubbles. If it's an infectious pneumonia, you might hear some bubbles going on. So you can actually listen to your heart or your breathing sounds and see how your lungs are working. And last thing?
Stomach.
Stomach, exactly. We can listen to your stomach, your belly, your digestion system actually makes noises while it's working. So we want to hear that there's actually noises going on, so we know that your digestion system is working. So people that are constipated or having irritable bowel or having other issues internally, we can actually listen to it, make sure their abdominal sounds are normal. Listening to it, and the funky thing we do with it, with the small end here, we would do on a
tendon.
A tendon, yeah. People don't really know that we can do that. It's kind of funky to listen to your tendons sliding through their groove. So people with a tenosynovitis or tendonitis, and people can actually sometimes know they can hear or they feel the grinding going on or something sliding. We can actually put this on and we can actually listen to the tendon sliding through its groove, and we can tell whether or not it's rubbing or being irritated. So that's kind of a funky little thing a lot of people didn't know we did. So that's kind of the stethoscope. And then to go with the stethoscope, we have the
blood pressure cuff.
Blood pressure cuff. So blood pressure cuff is again something we put on to test for
blood pressure.
Blood pressure, exactly. This is kind of the old school way, using the stethoscope. You put it on, put the stethoscope so you hear the blood flowing through your arteries to tell, your systolic, when does the blood start to flow through, when does the blood stop flowing through, to get an accurate measure of your blood pressure. There's also interesting things we can do with this to look for abnormalities, but it is more of a time consuming. Listening to that, so a lot of people now just use the automatic one. They put it on, it pumps itself up, goes down, gives you the automatic blood pressure. But doing the old school ways is a lot more accurate. But again, it's not done as often anymore. We've got
the Reflex Hammer.
Exactly. What do we do with this?
Test for deep tendon reflexes.
All right. So this is, as again playing doctor as a kid, you're gonna whack your sister's knees and see if it bounces. A rudimentary test for neurological systems to see if the nerves are working. Because certain reflexes, like here, is going to be what is that? L4, L5. See if I actually test your reflexes with this to see if your nervous system is working. It also has a sharp end.
It's for testing sensation.
Yeah, so again, it's for sensation. So we've done vibration, and now we can actually do sharp and dull. So we can actually put this on and say, does that feel sharp? Does that feel dull? Does that feel sharp? Does that feel dull? We can kind of go along and see how people's sensation to touch and sharpness is. So that's a good thing for that as well. Oh yeah, we've got, I'll put the first head on here. What would this one be called?
Autoscope.
An autoscope has the pointy thing on it. And what do we do with that?
Looking into the ears.
Yeah, so that fits in your ear. So people that come in and they're having difficulty hearing, we can use the tuning fork to test it, but we also look in their ear. Quite often people come in and their ear is full of wax. So they can't hear sound very well because their ear is full of wax. The noise can't get inside. And also, especially that's with older people, generally a lot with kids, it's looking for ear infections. So they come in, the parents are kind of saying they're kind of rubbing their ear or they're not feeling very well. We can actually go in and look at the eardrum and see if they've got an ear infection going on at all. And if they do, then we can refer them out and if they need to get an antibiotic, that's something your pharmacist or doctor could recommend. But we can check out their ear. We use this quite a bit actually in the office. It's one of our more useful tools. And then the last thing we have here,
Ophthalmoscope.
Ophthalmoscope, yes, that's for your eyes.
Yes.
Don't use this one very much at all. So with this, we can actually look in your eyes. So why do we want to look in your eyes? Well, we can actually look at the arteries, small arteries in the back of your eye. It's a good thing to look at them. We can see if you're suffering from, sclerosis of the arteries or hardening of the arteries. Rudimentary tests are looking for MS, because the back of the eye, the myelin sheath may be disappearing. Kind of look at that. Also use something called the macula, which is where the main nerve comes into your eye. And that can start to degenerate. You get wet and dry macular degeneration. So we can actually look at that point with this and see what's going on with it. This is something I don't use a lot of. This is something that more your optometrist and ophthalmologist would kind of look at. But yeah, it's something we do have. And the thing is, with all these different tools here, being a primary care practitioner, we have to know how to use them. So some of them we use more than others, but we're all trained in how to use all these different tools. So it's kind of an interesting thing we can do.
Hope you guys enjoyed this video. If you enjoyed it, please like and subscribe. Please share it with your friends and family, and comment down in the comments section whether if you have any questions or if you want us to cover any other videos. And as we say, it goes really well, this, we got your back.